Hello guys, welcome to my channel. In this video we will be talking about myopia. It is very important topic from ophthalmology. So let's define it first. It can be defined as a refractive error in which the parallel rays of light coming from infinity are focused in front of the retina when accommodation is at rest. So in a normal eye, those rays coming from infinity are focused on the retina, exactly on the retina, but in myopia it is focused in front of the retina. So the patient of myopia have blurring of vision, right? Now you need to know about the two terms. One is emetropia and the next is ametropia. What does emetropia means? It means the normal eye having normal vision, whereas ametropia means the eye having refractive error, which can be myopia, hypermetropia or astigmatism. Right. Now coming to its classification, it can be classified on the basis of etiology or by clinically. Etiological classification at first: axial myopia, curvature myopia, positional myopia, index myopia and excessive accommodation myopia. What happens in the axial myopia is that there is increase in the axial length of eyeball. Here is eyeball. It is there occurs the increase in axial length of eyeball, so that results in myopia. It is the most common form of myopia. Now coming to curvature myopia. What happens in the curvature myopia is that there is increase in the curvature of the cornea or lens or both, so that results in the rays of light to be focused in front of the retina. Now positional myopia, it has to do with the position of the lens. There occurs the anterior placement of the crystalline lens in the eye. When it lies anteriorly, when the lens lies anteriorly, then also the rays of light can be focused in front of the retina, creating myopia. Now index myopia. Index, it has to do with refractive index, right? When there occurs increase in the refractive index of the crystalline lens over here, when there is increased refractive index, then its convergence also increases, right? Due to increase in convergence, the rays of light coming from the infinity are converged too early, right? So that it causes myopia. Now coming to myopia due to excessive accommodation. Because of spasm of the ciliary muscles, they are unable to focus the light, rays of light properly on the retina, thus causing myopia. Now clinical classification. Clinically it can be classified into congenital, simple, pathological and acquired. The simple myopia can also be called as developmental myopia, and pathological myopia can also be called as degenerative myopia, and acquired myopia can also be called as secondary myopia, right? What happens in the congenital myopia is that the myopia is present since birth. It can be diagnosed a bit later, but the myopia was actually present from the birth. Now in simple myopia, it is also known as developmental myopia, as I already said you. Developmental myopia, it is the commonest kind of myopia based on clinical classification, right? From etiological classification, axial myopia was the commonest, right? And it is the simple myopia from the clinical classification, which is the most common. So the simple myopia, it is not associated with any pathology of the eye. It is simply a refractive error which occurs because of the normal biological variation in the development of eye, which may or may not be genetically determined, right? So it is that. Now coming to pathological myopia, it is also known as degenerative myopia. degenerative. We will describe simple and pathological myopia in detail in the coming slides. Now coming to acquired myopia, it is also known as secondary myopia because it occurs secondary to some other disease like post-traumatic, post-keratitic, drug-induced, right? So it is secondary to other conditions. Now let's move on to our next slide. Now coming on to grading of myopia, according to American Optometric Association, there are low myopia, moderate myopia and high myopia. Low myopia is when the refractive error is less than or equal to -3 diopters. Moderate myopia is when the refractive error is between -3 diopter to -6 diopter, whereas high myopia is when the refractive error is more than or equal to -6 diopters. Now let's talk in detail about the simple myopia. As I already told you that it is not associated with any other pathological condition in the eye, right? Now its symptoms are poor distance vision, of course, asthenopic symptoms like pain, right, and half shutting of the eye to achieve increased clarity. Yeah, the people tend to half shut their eye so that they achieve more clarity, because the ray of light will be coming more towards the from the principal axis rather than from the periphery, so clarity is achieved, right? Now coming to the signs, as I already told you that there is increase in axial length of the eyeball, which is the most common variety. So because of the increase in the axial length of the eyeball can be prominent eyeball, large eyeball, right? There can be anterior chamber slightly deeper than the normal, right? What is anterior chamber? It is a chamber which lies between the cornea and the iris, right? Now pupils are slightly large. Fundus is normal, as there is no any other pathology in the eye, right? And the magnitude of error is usually less than 6 diopters, right? And how can we diagnose it? The diagnosis can be confirmed by performing refraction. Now coming to pathological myopia, it is associated with degenerative changes of eye. Its etiology: genetics plays the major role in pathological myopia. When both the parent of the child is are myopic, then there is increased chance of having myopia in that child, and it can be because of general growth process as well. What are the symptoms? Symptoms are usually the same, but there are some other symptoms like musca volitantis and night blindness and defective vision, right? What are the signs? Like that of the simple myopia, there can be prominent eyeballs, but pathological myopia has more prominent eyeballs than that of the simple myopia. Large cornea, deep anterior chamber, pupils are slightly larger, and the major signs, they arise when we do the fundus examination. When we look at the optic disc during fundus examination, the optic disc is large, pale, myopic crescent at the temporal edge may be present. Myopic crescent at temporal edge, optic disc large and pale, and degenerative changes in the retina and choroid can be there, like chorioretinal atrophic patches at macula, Foster fruit spots, right? Cystoid degeneration, lattice degeneration, total retinal atrophy, posterior staphyloma, and in the vitreous also there can be some degenerative changes. Now coming to the complications of pathological myopia. The complications are retinal detachment. It is very serious complications of pathological myopia. Other complications are complicated cataract, vitreous hemorrhage, choroidal hemorrhage, strabismus fixus convergence, and primary open angle glaucoma. Now coming to the treatment, optical treatment first. Prescription of appropriate concave lens is done. Under correction is usually better. Why? Because under correction it avoids near vision problems and minification of image. That means if it is over corrected, then since the concave lens that we use in myopic condition are to improve the distance vision, right? So in doing so there can be some compromise in the near vision as well and minification of image. So usually under correction is recommended. So in which modes can we give optical treatment? In the form of spectacles, in the form of contact lens. Now surgical treatment. Surgical treatment is done after the refractive error has stabilized. That means when the power of the spectacles has remained constant since a long time, that means the refractive error has stabilized, then those persons are fit for surgical treatment. And the stabilization of refractive error usually occurs after the age of 20 years. Right. Now the surgical treatments that are available for myopia are: one is cornea based, one is lens based. In cornea based is more popular, and lens based, these are rarely done. Cornea based treatments are RK, radial keratotomy, PRK, photorefractive keratectomy, LASIK meaning laser in situ keratomileusis, RELEX, refractive lenticule extraction, ICR implantation, which means intercorneal ring implantation, and another one is orthokeratology, in which it is not actually a surgery. It is not a surgery, but it is a reversible method of molding the cornea. The cornea is molded overnight. The individual wears a rigid contact lens. Rigid gas permeable contact lens is worn by the person overnight, and for the rest of the day he achieves good vision, because that contact lens molds his cornea, making it flatter, right? Now the lens based surgeries are refractive lens exchange and phakic refractive lens, PRL. There are some general measures as well, like consuming balanced diet, focusing on visual hygiene. Some general measures can also be followed, like consuming balanced diet, focusing on visual hygiene. Visual hygiene means staying in the room with proper illumination, right? Adequate illumination, and maintaining good posture at work, especially for near work. And some low vision aids can also be used, especially for those with very high myopia. Genetic counseling can also be given, especially if both the parent are having pathological myopia. If that is the case, then the child is also more likely to have myopia of pathological type. So genetic counseling also becomes necessary. Thank you so much guys for watching this video. Don't forget to like it. Thank you so much.